It's Wednesday. That means it's time for Healthy Living. Today, Dr. Keith McEwen joins us from the Indiana Surgery Center Outpatient Bariatrics to talk about lap band surgery. Thank you for joining us.
Thanks for having me.
So first, who would be a patient for the lap band surgery?
Well, it's certainly not for someone who only needs to lose 20 pounds. We're typically looking at a patient who is anywhere from 70 to 150 pounds overweight.
And you actually have the device here. Tell us a little bit about it.
Yeah, actually it's a fairly simple procedure. Most people, when they think about bariatrics, think about bypass surgery, which is fairly complicated. This is simply a device that's laparoscopically placed around the upper part of the stomach and helps control appetite and portion size for our patients.
And is this done, how long are people in the hospital generally?
Essentially, it's an outpatient surgery,
Oh, okay.
so they can either go home that day or sometimes they'll stay overnight. And typically back to work within a week or less.
Now, if someone is thinking about this, what would they need to do? What steps do they need to take?
Well, it's something I always tell people to consider very carefully because it's an entire lifestyle change.
Exactly.
And so really the initial steps are to do your research, and you can do that online, talk to your physician about it. We do informational seminars as well, so I no matter which way people look into it, I want them to really think about things carefully.
And let's talk about one of those seminars. You actually have one coming up in Terre Haute soon. Tell us a little bit about that.
We're doing a seminar next Wednesday, and essentially it's an informational thing. There's no pressure on anybody. I just want to help people understand the obesity problem to begin with and what their options are, because again, I don't think a lot of people understand that typical weight loss with diet and exercise alone is about 10% of your body weight. So it's very difficult for people to get off, say, 100 pounds without doing something more aggressively.
Exactly, and that seminar is going to take place at the Holiday Inn at 7 p.m. Also, if people want to get a hold of you and find out some more information, if they can't make it to that seminar, how do they do that?
Yeah, I think there's a couple ways. One is through our website. There's lots of information on there. That's lapbandindiana.com. And again, there's lots of information about the practice, about the procedure itself. If they call our office, 621-2500, we can also give them information, and we can even show them an online tutorial that they can do. So if they can't make it to a seminar, there's a way to get all that information in their own home.
But as you were saying, the key thing is to get the information, because this really is a lifestyle change, because once you do this, you can't go back to eating the way you used to.
Exactly. It's a long-term commitment. After the surgery, I see each patient monthly for the first year so that we can adjust the band and control the appetite. So yeah, it's a big change, but the changes we see are very worthwhile.
Wonderful. Well, thank you so much for telling us all about this. We appreciate it.
Thanks for having me.
Thank you. Again, our Healthy Living segment airs right here on Wednesdays. If you'd like some more information about healthy living, check out our website at WTHI-TV.com. News 10 at midday. We'll be right back. Stay with us.
The views expressed in this program are those of the presenters and sponsors and are not necessarily those of WTHI-TV or its corporate parent. This program is for informational and entertainment purposes only and is not intended to replace or substitute for any professional medical, financial, legal, or other advice. WTHI-TV makes no representations or warranties regarding this program.